I'm Dr. Fergus here with Cornerstone Health in downtown Evanston, and I've got Henry with me today. Henry's been telling me he's ready for a tune-up. He's been feeling kind of stiff all over, and we've got a couple key spots to work on, especially, is it your right foot? And where else?
My right shoulder.
Right foot, right shoulder. Henry does a lot of activity in boxing and weightlifting, so we're going to kind of break into that in some of the history. But the first step for a lot of these cases is just making sure when the joints need to move in a certain way that they have the capability to do that. So we're going to be checking to make sure his joints are moving the way they need to for everyday movements with some specificity for boxing and weightlifting. I'm going to start with the neck. So let's have you just kind of scoot forward. You get to slouch to start with. So slouch and lean all the way back towards me here. And we're going to first check in on the cervical spine. So as I'm going through here, I'm palpating C1 and C2, the top two vertebrae in the neck. And we have a little more restriction on the right side than the left. And now I'm also going to check the occiput where the head and neck are connected. So far as I've gone through this, we know that his joints, when they're healthy, rotate a certain amount based on what we find on the left side. And in comparison, we've got some restriction to just his personal normal movement on the right. And the adjustment is going to help us restore that. So we get to get real comfortable now, slouching a little further. So bring your hips right to the front edge of the chair and lean all the way back like you're reclining in the movie theater. Let your head rest against me. So I'm going to start with the right occiput. He's just going to slowly relax his head to my side and look to the left. And we've got the occiput. Now we can recheck that from side to side and make sure that normal movement's there. Okay, we'll check in on C2. Exhale, and C3. Okay, one more spot here on the right. Now, lean back one more time, tilt a little to the side. And to this side, lean towards me. Okay, now I'm going to get the upper thoracic spine extension. So let's have you stand up. Okay, and lower that back down. Now this is always a challenge when a patient is a similar size or larger than I am because I have to lift him up through the joint. But this is also one of the things we do here is work with athletes, work with people that need a little bit more force on some adjustments as well as those that need less. Let's have you face that wall again. I'm going to be kind of giving you a hug from the back with elevation into the shoulder area. So this is going to be right here. I'm going to have you go into a slightly wider stance, and at some point I'm going to have you bend your knees down a little bit as well. So a little bend in your knees. Good. And I want you to bring your hands back to the back of the shoulder. Can you lace them together like this? Good. Any pinching in the shoulder, or is that okay?
Slight pinching in the right shoulder.
Okay, let's bring your hands up a little further. How's that on the shoulder?
It's fine.
Elbows together a little. That's still okay?
Mm-hmm.
All right. Okay, so I'm going to bring my arms to here. Now you can bring your elbows a little bit forward. Is that still okay on your shoulders?
Yes, sir.
Good. You're going to lean back towards me. Take a deep breath in. Bend your knees as you exhale. Okay. Any sensitivity as I'm pressing into the back?
A little bit lower, yes.
Okay.
Yeah, right there.
Only on the right side?
Yep.
Both sides. All right.
Left side's fine.
Good. Okay. I'm going to make a contact to the rib cage and to the spine. Nice deep breath in. Let everything relax. Let it rest. There you go. Good. One more spot here. Deep breath in and exhale. Let it rest, let it rest. And again, breath in and rest. check how your lumbar spine rotates now. We're gonna keep your bottom leg straight. We're just gonna bend the top leg to here, and I'm gonna let your shoulders roll back. So, any pinching or irritation in the hips during this setup?
No.
Okay, let me take your bottom arm. Nice deep breath in. Let the whole back relax as you exhale. Good. Let's go to the other side. Top leg bent. I'm going to keep your shoulders where they're at. You're going to let your hips roll forward like you're going to fall off the table. Do you strike on the right side?
Yeah. And
Does it feel comfortable during that?
except for the foot, yes.
Okay. So the shoulder wasn't bothering you until afterwards?
No, the shoulder, I only feel the shoulder strangely when I reach around into the back of my car to put something in the back seat. And
So
then I'm like,
external rotation through here.
yeah. Like it's not a lifting issue. It's a external rotation.
You getting any pinching through this motion?
A little bit at the top, yeah.
Is that right under my fingertips here?
Yes, sir.
How about when you bring the arm across your body?
No, I don't feel it.
Okay.
Nor do I feel it when I press.
Bench press is okay?
Yeah, bench press. Took the words right out of my mouth.
Right. So this is the subclavius muscle. It runs right underneath your rib cage. Right under the collarbone on top of the rib cage. It's one of the few muscles that rotates your collarbone upward. Pec rotates collarbone downward. The action of the biceps rotates the collarbone downward. So there's not a whole lot of advantage for this one muscle, but that muscle has to rotate the collarbone upward in order for you to unlock some of the other shoulder muscles. So that's what we're gonna get to here. Tolerable at that level? All right. So I'm using a tissue mobilization now called a targeted structural intervention. I'm looking at a specific piece of connective tissue that inspires a movement that was challenging for him. It's similar to a massage technique, and that I'm pressing deep in on a muscle and connective tissue barrier. We're trying to do it with inpatient tolerance load. However, these things, we have to get into them and change them in order to restore function. So they can be a little achy at first. Usually the movements improve pretty dramatically afterwards. Okay, we're gonna do a little more mobility work into the shoulder. I want you to rest your elbow directly against me. Just rest it. Let it go completely. Is that uncomfortable in that position? Okay, now I'm gonna pull the tip of your shoulder towards me. Comfortable in that range of motion?
Yep.
Good. Okay, let's get through that external rotation again. Relax the arm.
Yeah, much better. Yeah, I don't feel that pinching at all.
Excellent. How about in this range of motion?
I don't feel any pinching. Went back and saw him Tuesday, and same coach, and I said, man, I got to tell you, since kicking you in the elbow, my foot has hurt for all week long. And he said, that's funny. He said, that's funny. My elbow has been hurting all week too.
Okay. And most of the discomfort's been right on the top of the foot?
Yeah, I noticed yesterday, even putting weight on it was painful.
So when you put weight on the bottom of the foot, you're feeling discomfort on the top of the foot?
When I was exercising, yes.
Okay. So it does seem to have some bruising on the
Yeah.
top surface, so we're gonna check that out first. As I press in, any sensitivity just on the surface?
As you move further to my right, yes.
How about here? This is okay in this area?
Yeah, it's okay there.
That's right over the top of the foot.
Yeah. He said it was a good kick. It just happened to miss.
I bet. If I'm just isolating joint movement here, is that tolerable?
Yes.
Good. And here?
Yeah.
Good. So I'm first checking to make sure the bones and joints that we can assess are not a source of the discomfort. Ideally, it is just going to be the bruising, contusion on the top.
Yeah.
We'll do a few additional tests before any mobilizations. First, we're going to make sure that the gliding motions of the ankle are still okay. Let your foot rest. So I'm making sure his ligaments are still intact. Any discomfort with this?
No.
Perfect.
Now, when you turn.
Yeah, we have a little more inversion on the right than the left.
Yeah.
Is that sensitive to your symptoms?
Yeah, a little bit. Yeah.
So what was the strike like? Did you strike the elbow at this portion of the foot?
Yes, sir.
Okay. So we're just going to check these lateral ligaments now. Any sensitivity directly into these lateral ligaments?
Not right there. No.
Okay. And if I squeeze, just that superficial
Yeah.
squeeze is
Yeah.
uncomfortable? Okay.
Yeah, right at that one spot.
Okay, let's...
Sorry, didn't mean to gasp so badly.
No, that's okay. That actually tells us a lot because there was no joint movement when I did that squeeze. It was purely squeezing into the sensitized tissue on the surface.
Okay, good.
So now we're going to move the joint and make sure that that's comfortable and not sensitive. So I'm going to traction at the heel. That's still okay.
Yeah.
I'm going to rotate at the foot. This is still okay.
Yeah.
Good. Okay, so at this point, I can treat the joints of the foot that are reacting to the injury without irritating any connective tissue, ideally without irritating the bruise. Hopefully get some better overall movement in the foot, let you heal up a little bit faster.
Good.
Let everything rest here. My contact's okay there?
Yeah.
Good. So there's a few adjustments I'm going to avoid just based on the location of the contusion. Is that contact okay so far?
Yes, sir.
Let everything in the foot rest.
It's remarkable how you're able to still work on it and yet miss the place that hurts so bad. It's real skill there.
Appreciate that.
Can you tell I just had a pedicure?
Nice, I like it.
Yeah.
First one?
First one in 6 years, baby.
Wow.
It's felt great.
How's the big toe been doing on this side?
On that side, fine. On the right side, it's been much more painful. I think you can see the marks with my weightlifting shoes.
Yeah. Is the discomfort only on the top of the toe?
Yeah.
Okay.
Yeah, I felt like it was about to fall off.
It won't fall off, but you do have a little bit of joint degeneration around the top of the toe.
Okay.
So right now, when you're walking, are you comfortable putting pressure through the big toe?
Yes.
You are, okay.
Yes, most of the time.
Okay. So in cases like this where we have limited total big toe motion, we still want to induce a little bit, but we can't do anything super dramatic. Can't use big adjustments on the area. We want to gradually ease that up. So we're just going to create some traction at the joint and slide slowly up into the barrier and light joint mobilizations. Sometimes we can only start with a few degrees like this. We're already at that sensitive spot. Is that level of pressure okay?
Yeah.
All right. So I'm working through the external rotators here. As I'm applying pressure on this spot, I want you to gradually rotate the arm up this direction. Good. When you find the barrier, lower it back down. Nice job. Let's do 2 more there. Great. Okay, Henry, let's get you up off the table.
All right.
All right. Then stand up, move around a little bit. Let's see that shoulder motion.
Whew. Yeah.
Nice job. Any catch still?
No.
Okay. Give me a little twist. Let's see if there's any limitation in the low back.
Look at that.
Nice job.
Compared to where we were.
Cool. I'll do one more little check on the neck so I have a seat. Make sure everything's moving. Okay, so I'm still seeing a little tension in the SCM, but everything else is moving well. I'm going to teach you how to do a self-SCM stretch. It's more of a massage. You can do this before you're doing your boxing. So the SCM runs on an angle from here and here, united in a one cable that goes down to here. So you're going to rotate your head away. You're going to lightly pinch with your fingertips this muscle. It's not deep into the throat, it's right on the surface. You want to lightly squeeze that muscle and then rotate your head towards and slowly squeeze in until it's mildly sensitive right there. Let's see if we can create that contact. Good. Then you're going to just slack that muscle towards. And then do you have a good grip on the muscle? So you give it a squeeze until it's just a little bit achy. Sometimes that sends some symptoms up to here or down to here. And while you've got that squeeze, you can do a little head rotation, left and right, even slower. It's more about the pressure on the muscle than a little bit of motion. Good. Okay, so a great one to do once or twice a day before you do your boxing. Okay, so this is a quick tune-up session of Henry. It's been a while since he's been in. The main thing I wanted to do today is make sure his joints are moving in a way that are conducive to the activity that he wants to do. And that can make a really quick change to the range of motion as well as the comfort in the range of motion. Henry, any words about where you're at in terms of your fitness and kind of how things have gone with your care here?
I mean, sure, yeah. I mean, Dr. Fergus, I came first a couple years ago with a noticeable limp every time I took a step, and basically Dr. Fergus retaught me how to walk. He showed me where I was stepping kind of funky, what I needed to do and how I needed to shift my gait, got me fitted for insoles, and then worked with me to relearn how to take one step after another. And for that, I mean, he gave me the gift of walking again. I mean, how can I not be grateful for that? I've recently gone down from 370 pounds to about 300 since I started boxing and other various things. I was a competitive power lifter. Boxing has been great for me in both weight loss, but also just getting me moving altogether. But it has also brought more aches and pains, such as, you know, overusing the shoulders, because, you know, you're punching a bag hundreds of times. This work that we've done today on the shoulder, I can already feel the difference in just rotation and mobility. I'm just really grateful for that, because I'll be able to see that in the ring. As an older man boxing against folks, you know, 10, 15.
I don't think you can call yourself an
Well,
older man.
I box against people 10, 15 years younger than me. You know,
Really? Okay.
I need every advantage I can get.
Yeah.
And keeping me mobile, keeping me moving, keeping me so I'm not hurting. I'm really grateful for that.
Yeah, excellent. Great. Well, thank you for tuning in, and we'll see you next time. Okay, so we found a little bit of degenerative changes on the crown of the big toe or the top surface, which is really common. It's one of the first things that patients will get when the toe starts to have a little bit of stiffening change is the bony material on the top of the joint gets a little bit larger, and so when we lift up, it can create pinching both on the top of the toe, and it can create compression right on the inside of the toe. Nothing has changed the game for us as much as introducing focused sound shockwave therapy. This essentially brings a specific sound wave to a specific tissue, whether that's connective tissue or bone, and starts to spur on a healing change. This does work on arthritis just as well as it can work on soft tissue changes like tennis elbow or plantar fasciitis. So we're gonna get Henry set up for that treatment now. It just uses a little bit of ultrasound gel on the top of the toe. And now we're gonna set this at a very low setting. And we're gonna make sure it's fully comfortable before we do anything else. So at a low setting, I'm gonna go right over the top of the joint and start the device. I'm gonna turn that right off to make sure it's comfortable. Any sensation there?
No.
So the unique thing about this device compared to most of the other services is it's diagnostic in nature, meaning it's only gonna cause any symptoms if it's directly on a tissue that needs that healing response because it has sensitive C fibers due to injury. So right now, no sensation, right? So I need to increase my intensity as we scan again at a slightly higher intensity to find the key tissue.
Yep.
So right there is one setting up that's noticeable. I'm gonna drop that back down. Is that still noticeable here?
Very slightly.
Okay, so we know we're in a good spot. We're just gonna increase that intensity slightly. Still okay here? What number would you give this?
I would give that a 6 or a 7
Okay, is that tolerable for a moment?
for a moment.
Okay. So right now we've got the shock waves going directly into tissues that have pain-sensitive C fibers. What happens over the period of a few days to weeks is this type of therapy stops the growth of those pain-sensitive fibers into the tissue. And it also spurs on the cellular healing change. So the joint and connective tissue will begin to change based on this input. And the type of tissue might take a few weeks to 1 to 2 months to create the complete change. Is this still sensitive at that same level?
At a lower level.
Okay, okay. Let's find that spot again. Any sensitivity here?
Nope.
Good, we're gonna scan over to our next spot. Let me know the next time you feel sensitivity.
It's beginning to.
Right in this spot. And then
Yeah, the more you go up. Or
what number
whatever
are
you
you
do.
at here?
Like 3,
We're gonna just do one click up on intensity.
2 or 3.
That's gonna slowly build. What's it at right now?
I've lost feeling.
Meaning it's numb?
Yeah, it's. I'd give it a 0. I don't
A
feel
0.
anything.
Okay. That's better than losing feeling and being
Yes,
numb.
yes,
So
yes.
it's less sensitive there. Okay, let's go ahead and go up just one setting. Okay, we'll take that back down.
Right there. Right there.
There we go. Okay, I'm going to slowly move through the joint range of motion. Still okay here?
Yep.
Okay. Let me know when that dissipates, it feels like nothing again.
Okay.
Good. Okay, so we've used about 2,000 shock waves directly into the joint. Immediately we'll get a change in blood flow, which can affect the pain sensitivity. And then within 1 to 2 weeks, we'll start to get a change in those pain sensitive C fibers. And if we repeat this session, it starts to gradually improve the turnover and laying down of new healthy cells that allow better joint motion.